Uh, Hello, college uh, teacher. My name is Orlando Guerra. I am Otolaryngologist, and I'm graduate the University de El Salvador. I went to a specialist in the United States in Boston Medical Center. Uh, I had the opportunity to enter with a scholarship. uh, I need to have the intermediate level of English, and I took me 4 years to be able to finish my specialty, and the reason why I wanted to have my specialty was because it had caught my attention. Since I had ear problems, I had to have surgery in ears, and they had removed my tonsils. I went the doctor. I had respect for him. I wanted to be like him. I work in the Benjamin Bloom Children's Hospital in San Salvador. I work, and now I will explain to you hours the of attention that I exercise. Hours for attention. This is a four, four. Sorry. Ears, nose, neck, head, and throat. Cinco, una disculpa. Ears. They treat a great range of ear problems for common middle ear infection to more complex problems such as ear loss, tinnitus, and balance disorder. They also perform surgical procedures that treat ear loss such as placing ventilation tubes in the ears to drain fluid buildup in the middle ear. Number 2, nose. They deal with the diagnosis and treatment of nasal disorders such as sinusitis, nasal polyps, larynx, nasal sputum, and recurrent nosebleeds. Additionally, they might perform surgical to correct structural problems of the nose such as rhinoplasty, a well procedure improvised, and such as cetoplasty. Number 3, throat. The throat condition such as tonsillitis, pharynx, inflammation of the pharynx, larynx, inflammation of the larynx, and voice disorders. They also diagnose and treat more serious throat diseases such throat cancer. Number 4 and number 5. This area compasses variety of conditions that affect structures in the head and neck, including the limbs, nose, thyroid, and salivary glands. Uh, Diagnosis and treat belly and malignant tumors in their eyes well as before surgical procedure to remove them. Now we explain some the types of disorder that we treat. para esta parte lamentablemente no pude hacer diapositivas. Ear disorder. Number 1, hear loss. Number 2, ears infection. Number 3, cholesterol. Number 4, perforate eardrum. Nasal problems. Uh, Number 1, chronic rhinorrhea of runny nose. Number 2, nasal obstruction. Number 3, nasal mask. Throat disorders. Sleep apnea, uh, tonsillitis, and recurrent laryngitis. Number 2. Number 3, hoarseness and voice disorder. Head and neck disorders. Number 1, neck and head masses. Number 2, enlarged or damaged lymph nodes in the neck. Number 3, hemangiomas and other vascular malformation. Airway disorders. Number 1, stridor or nosy breathing. Number 2, laryngomalacia. Number 3, vocal cord paralysis. And now explain something to you about the specialty that I practice. Number 1, otoscope. This is an instrument used to examine the ear canal and eardrum. It allows the doctor to observe signs of infection, inflammation, creo que es así, or fluid bullying in the middle ear. Number 2, rhinolaryngoscope. Used to examine the nose and throat and can be flexible or rigid. Allows the doctor or visualize the nasal and laryngeal, the structure in ideal. Number 3, laryngoscope. The laryngoscope used to examine the nose and throat and can be flexible or rigid. Allows the doctor to visualize the nasal laryngeal structures in detail. Number 4, endoscope. Use endoscope to perform minimal invasive procedures in areas such as the nose, throat, and upper airways. These instruments allow them to obtain detailed images of the interior of these structures without the need for open surgery. Disculpen. Number 5, surgical microscope. During ear surgeries and other surgical procedures, use surgical microscope to obtain the magnified and detailed view of anatomical structures, allowing them to perform procedures with precision. In short, the otolaryngologists are specialty in the diagnosis and treatment of variety of conditions affecting the ears, nose, and throat, and related structures in the head and neck. We use various special instruments to examine patients and before surgical procedures when necessary. Thank you for your attention.